Welcome to Menopausal Morning, your go-to for all things menopausal. I'm Diana Johnson, menopausal guru and fellow menopauser. Video number 14 in our series is on the changes to our complexion. When we're new, our skin is as soft and smooth as the flesh of a marshmallow. That's why everyone loves to touch a newborn baby's cheeks. They're so smooth. They're marshmallowy. As we move through childhood, we can acquire any number of exposures, from sun and wind to dirt and running with scissors. Adolescence can be a nightmare for our complexion, introducing our first hormone fluctuations. Acne, discolorations, increased sweating, oil production, and hair growth can wreak havoc on our complexions and our confidence. Then, during our childbearing years, if indeed we do opt for the bearing of them childrens, we can experience a plethora of skin changes, from glowing and healthy to acne and hormone shiners. Many women develop chloasma, dark blotchy brown confetti-like patches on the forehead, upper lip, and cheeks, sometimes known as the mask of pregnancy. Most of these abnormalities resolve themselves after the birth of the baby. Others remain for months and sometimes years. And still others are present clear up until the time that the cosmetologist at the Am I Gone funeral parlor and internment chapel cover them with pancake makeup specially formulated for the recently inert. And transitioning into menopause can bring about even more deviations. The texture of our skin can morph from the soft feel of silk to the coarse sensation of 40 grit sandpaper. Pores grow larger, creating a microscopic moonscape on the surface of the skin. Conditions like rosacea can appear, brought on by an overpopulation of mites causing an inflammatory response on the skin's surface, or an inflammation of the guts, or a combination of the two. Rosacea can present with a reddened butterfly rash, second to broken blood vessels under the surface of the skin, as well as hundreds of tiny pimple-like pustules. In the worst cases, the nose can swell and become bulbous and ruddy, but this extreme is rare in women. Either that or the women who are experiencing it never leave the house, so no one knows they have it. We can lose the youthful glow in our faces, giving way to a dull complexion. Our lip lines can feather, and the dense pink pigments of our youth can fade into pale, fleshy hues. We become blotchy, crepey, wrinkled, grizzled, and greasy. And all these changes mean more work for the menopausal woman. We have to get up hours earlier than was once the practice and use all manner of tools and materials to appear as if our skin is not aging. There are exfoliants used with or without brushes, wipes, pads, sponges, and cloths. There are moisturizers to reintroduce oils and hydrators to replenish water in our skin. We use caffeine preparations for our under eye issues, smoothers for our crow's feet, and everyone's seen that crazy glue looking shit that irons out the bags under your eyes in under 3 minutes. Scary, people. That cannot be natural. And then there are the folks that encourage facial exercises to tighten the tissue under the skin and ward off the inevitable sag. And what happens more often than not when implementing all these products and preparations is that we end up adding to our already complicated issues of our skin. We can actually worsen or exacerbate conditions by piling on the fixes we employ to reverse the normal changes that happen in midlife. I have no recommendations for products or procedures that work for everyone, but I do go by the rule of thumb that less is more. All the girls in my group try to use products that cleanse and protect, and they stay within the same skincare line. If your favorite cleanser is from Almay and you're moisturizing with Olay, you might be inviting a kind of chemical warfare on the surface of your skin. Look for a line that has all the products that you use, including your makeup. I think the fewer chemicals, the better. And most of the girls in my group would agree that the fewer steps in your routine, the better. Treat yourself to facials when you can. and search for do-it-yourself masks that you can make out of ingredients you find in your kitchen. If you can eat it, it's probably super safe for your skin. Think coconut oil and organic yogurt. I hope this film has delivered a level of acceptance and support for those of you struggling with your middle-aged skin. And remember, having compassion in your heart and peace in your mind reflects beautifully on your complexion. It just looks good on you. So until next Monday, peace, love, and menopause.